Welcome everyone. I'm Dr. Hamza Al-Ashwah and this is a new case in our playlist which related to the examination frame in MRCS Part B examinations. We have today the hip joints case which important, little important than me, but it's important. After introducing the room, we have our frame as we said before a lot. Wash your hands and introduce yourself and confirm the patient details and explain the examinations, gain the consent and the exposure and also offer the chaperone, and don't forget to ask about the pain and go for the scope of the case, which orthopedic case, so we have to look and feel and move and doing some special test. And don't forget in the end to thank the patient and wash your hands again and go for your examiner to doing a small discussion about the case. We have to go by details, okay? Firstly, wash your hands and introduce yourself. Hello, my name is Dr. Hamza. Or don't say hello. This is advice from my doctors. We have to say good morning, good afternoon. Don't say hello. Okay? Good morning. My name is Dr. Hamza. I'm one of the surgical doctors. Could you please confirm your name and age for me, please? Okay. Today I have been asked to examine your hip joints, both hip joints, which was that okay with you? Okay, and also ask about the exposure, which including exposure of both legs, fully exposed. Okay, I may expose your back. Also, the chaperone was the examiner was you as a chap. Okay, to offer the chap, and don't forget to ask about the pain before start. Do you have any pain at the moment? Okay, after that, we have to go for the look from standing position, as we said before. Firstly, you have to go the gate. Okay, observe the gate. Could you please take a few steps for me? Okay, and observe the gate cycles, assess the symmetry and determining positions, not any signs of discomfort. Okay, and going to test the Trodenberg test from the patient standing. Don't after the patient lie down and ask again to stand and doing the Trodenberg test. It's not it's not good, not good to uh, to ordering your steps. So we have to firstly by the gate and then Trodenberg test, and also when the patient standing, we have to look from the front for what? For scars, for pelvic tilting, for quadriceps wasting, and also look from the side for what? For lumbar lordosis, for knee flexion, for foot arches, and also look from behind for what? For scoliosis, iliac crest alignment, for gluteal muscle bulk. Okay, we have to go for the palpations or the feeling. Firstly, we have to ask about the pain again. Do you have any pain before the touch and the patient? Do you have any pain at the moments? Okay, and go for the temperature. Okay, uh, the also palpate the tissue surrounds the hip joints, anterior superior spines, pubic symphysis, gluteal tuberosity, and also palpate the greater trochanteric. Okay, may suggest trochanteric pericytis, and also measures apparent leg length. Okay, from umbilical to tip of medial malleolus. Okay, and also measure leg, the true leg length, which from anterior superior iliac spine to the tip of medial malleolus. Okay, If it's short and true, it's you have to doing Gleason or Alice test. Okay, in femur discrepancy, you have to measure the distance before anterior superior iliac spines and lateral and greater to breast. Okay, after that we have to go for the moving. Firstly, the active moving. After this, passive moving. The active flexion of the hip joints and also adduction and abduction. The passive one, we have to do inflection, adduction, abduction, and internal rotations and external rotations, and take care don't do it if there is hip replacements in the history or in the history or the stem of the patients, and also doing passive extension. The special test we have to do, it's Thomas test. We done trading bag when the patient standing, okay, and we have to do Thomas test at the end. After this, we have to thank the patient for thank you for letting me examine you. Do you need any help? Do you need any help to get dressed? Again, okay. Thanks a lot, and wash your hands and go for your exam. By this way, you have to collect more marks by systematic way. Um, um, give you a points to collect more marks. Okay, I promise you you will get more marks by this systematic way. I promise you. Thanks for your listening. Dr. Hamza Al Ashwah with you. Okay, thanks.